Initial visit only. Save 25% on windows and save 25% on patio doors. And with our financing, pay nothing for a year. We're offering virtual appointments too. Get a price from the safety of your own home. Our 25% off sale ends October 31st. Call 1-800-919-0909.
Chattanooga Mobility and Lifts, your stairlift expert.
It has been far too long since I've been able to stand out here and say good morning face to face with my good friend Alan Valenzuela, but good morning.
Good morning to you as well.
Alan, of course, is with Alliance Physical Therapy, so he's going to get us up and moving this morning because you're doing some stretches for us today, right?
So, yeah, we haven't talked a whole lot about the thoracic region or the mid-back region. Generally with people who have back pain, we always talk about low back pain or neck pain.
Right.
It's the majority of people, that's where they experience that. But the thoracic region or the mid-back area is an area that people have troubles with, and I've got a few simple things people can do at home.
Okay, I know it's going to be a challenge because here you are having to hold that microphone and then show off your skills. So why don't you kind of walk us through, this is your thoracic region, right? Truly your mid-back.
Mid-back.
But that's also kind of where your lungs are, Alan, right?
So your lungs sit right in front of that thoracic region, that's right.
So I was watching as you were kind of showing me what you were going to do this morning, and you're opening up your rib cage, it looks like. It seems like that would be beneficial to breathing.
So good. So it would be. I mean, if people have breathing issues, I mean, there's a lot of things that can be going on there. But if your ribs and your thoracic spine are locked up, breathing can be difficult, obviously, and a lot of these exercises will free that up. So let's just start with something as simple as stretching the thoracic spine. So there's two movements I like to do.
Okay.
I'm going to illustrate them both real quick as I move away from this microphone.
Okay, just put it on the table and maybe it'll pick you up a little.
Okay, so here's the first one.
I feel like I'm praying.
Okay, so did you see how I arched my back
Yeah.
when I went forward?
Yes.
So I'm arching that. So without the arch, you don't stretch that thoracic spine.
Okay,
so feel that. There you go. So you got a nice stretch there.
That feels so good.
You can feel that. It does feel really good.
Would that also be good if you had tension up here?
Absolutely, because you can see your arms are stretching as well as your neck is stretching.
Yeah.
You're putting a little stretch in low back, but it really stretches that thoracic spine. So we want it, once we've done about 20 seconds of those, and you can do it as often as you want or as many as you want, then we want to go the opposite direction.
Okay.
Okay, so the opposite direction is going to look a lot like this.
Okay.
Try that one.
Okay.
I want you to see, I want you to feel it. Because you can feel it.
Yeah, I can feel
So you can feel it stretch really well. And it's, I mean, there's not a lot to those two things, but there's so much pressure that's put on the thoracic spine and stretch to the connective tissue surrounding that area that it doesn't take a whole lot.
But Alan, you were talking about this if you have pain in your thoracic region, but what if you don't? It seems like that's just a beneficial thing to keep you limber.
For keeping mobilized, it is a great way, especially on a Swiss ball. Laying over a Swiss ball, either forward or back, that stretches that area really well.
I can see that.
Okay.
All right.
So now we want to put a little torque on the thoracic spine, so we want to rotate, twist it, okay?
Okay.
And so what you're going to do is this. You're going to stand up straight, by the way.
Okay.
Good posture.
Okay.
So.
You look like a statue.
I know.
A piece of art. Okay.
So try that real quick, nice and easy, because it can be strenuous. Can you feel that? It'll strain in that scapular region.
Yeah.
So what happens is because you're twisting your arms, one up and the other back, flexing one, extending the other, the spine actually does a rotation movement.
It just feels good. I didn't really.
It just kind of stretches it. So on you, I'm a little tight, so I could feel it in my scapula.
Well,
so.
and I think I must be tight up here
Right.
because I could feel that so much when I did this one.
Exactly.
Okay.
So that's a good, nice twisting stretch that you can do, and you can either hold it statically, I like 20 to 30 seconds, or you can do repetition. So I like dynamic stretching more than anything because it just puts a lot of energy in that tissue and gets it to relax a lot easier.
Okay.
Now all of these, start slow and don't force it. There's
Okay.
no point forcing. Start slow until you start to feel it give way.
Okay.
All right, from there is this one. Hands out in front. So nice little rotation component to that. You
Yeah.
can feel that just mobilize that thoracic spine.
So here's what I'm thinking. I'm thinking about how many people are probably like I am, but you get that midday slump. Whether you're working from home, where your office setup is not what it really would be in the office, or you're in an office and you just still get the midday slump. Those would be easy things to just get up and do.
You can do them standing, which is always good to get up every 15 minutes from a workstation is my recommendation, or sitting.
Every
Obviously.
15 minutes.
I like 15 minutes. If you're
Wow.
sitting at a desk doing work in front of a computer, you should get up every 15 minutes and do some extension type exercises, because we generally sit at a computer slump. All of us do it.
Speaking of that, do you find that kids today have more issues than they used to for that very reason, because they are in front of that screen so much?
I don't know. I haven't
That's a
seen
setup
any
question.
statistics, concerning that, but I would guess it's probably true.
I would think they
I mean,
would.
not just being in front of computer screens, but the amount of kids that play video games, all of that,
on their phones all the
contributes
time.
to that.
Yeah.
Absolutely, on
Yeah.
their phones all the time. Absolutely. I mean, if you ever go into church, even, it's really sad to what I'm about to say, but people are on their phones even in church, and if you ever look across the pews, they're all slumped over.
That's right.
You know?
That's right.
And so you just look at right across, everybody's just
Like
slumped
when the
over and
story
on their
came out
phone.
about getting the horns on your head, remember? It was because of that.
Slumped
posture.
over.
Yeah.
Exactly. So I'm going to show you one more.
Okay.
So this one I would do on my hands and knees, basically. But I'm
Okay.
going to show it on the table here because it's just a little more aggressive.
All right.
It's the same movement we just did, but again, it tends to be a little more aggressive, and you're going to want to move your head with this movement.
Okay.
So.
That's harder. I can't do that one. Okay, here's what I noticed. When I did that, on this side especially, one of my feet wanted to come up.
One of your feet wanted to come.
Yeah,
So,
why?
So your whole kinetic chain is locked up. So just with that movement, it means you got a lot of tight connection tissue going through to your hips.
To try to make my arm go all the way up, my toes going up.
Yeah. So you're really tight on that side, obviously, and you need to work on it. But again, that exercise, you can do it just like we did here, and you can tell it tends to be a bit aggressive. But on your hands and knees, it's a really nice movement.
Would these be good to do before you work out?
Absolutely. Yeah. Now, before a workout, I don't like cold stretching. And what I mean by that, static stretching, where you stretch because your tissues are tight. You're better off to warm up, okay, before a workout.
Like a little bit of
or
an
doing
aerobic movement?
Yeah. Do dynamic type stretching where you're just adding a little bit of heat till it gives way.
Okay.
Does that make sense?
Yeah, I think so. Otherwise, your
You're
muscle's
kinda
not ready
torn.
for the movement.
Yeah, exactly.
basically.
And you're putting too much pressure on it.
Okay.
Warming it up. But stretching is usually better after activities.
What about the benefits of if you have ever gone to physical therapy, you leave with a booklet almost of exercises that you'll
Right.
do from home. Is it a good idea, though, to keep those going
Absolutely.
for a long period of time?
Yeah, especially people who have chronic problems. All those exercises that you get from a physical therapist are therapeutic in nature.
Mm-hmm.
They're designed to keep your limbs and your spine mobilized so that you can be functional without hurting yourself doing normal daily activities.
I talk about her all the time, and I'm sorry I do, but my mom is 90, turns 90 next month, and every day she had a back issue when I was 10. So for 40 years,
She's been doing those
she
exercises.
does these physical therapy exercises, and she's added to over the years with other injuries that have come her way. But she takes about 45 minutes in the morning
Good for
to
her.
get those done.
That's
but
huge.
it works for her.
Well, not just that, and I think this is a sad thing. The older we get, the less we move. Well, the less that we move at that age, the less we're going to be able to move.
Mm-hmm.
So as we get older, we need to be moving more often, because we can still keep strength. We can keep strength in our body so that we don't become debilitated. It's a big deal.
And it becomes a habit like brushing your teeth in the morning. If
Yeah.
you'll just do these things before you leave for work in the morning or begin your daily routine, you'll keep it going.
Absolutely.
Okay, where can people find you and talk about COVID and how things are going at the office? Because you're still being very careful of
So we are still
restrictions.
being careful, and I don't know if they're going to discontinue the mask here pretty soon, but we will probably continue it in the clinic. So For those of you that are concerned, we'll probably ask you to continue to wear your mask in our facilities. We'll also only allow patients into our facilities.
Okay.
Our employees will wear masks during treatment sessions. So COVID's not going away. It's going to be with us for quite some time, and we're going to learn better ways to manage it, I hope. But for now, we're going to be as cautious as we possibly can.
And as you have stressed before, even before COVID was part of our vernacular, most of us have a limited number of visits physical therapy wise with our insurance. So if you have been delaying going to get the PT that you need because you are afraid of exposure, you're really adding another layer of complication on, because the longer you wait to get that PT going, the more you need, then you run out of your sessions.
Yeah, so the opioid problem is still here, and it's worse now. So the secondary effects of COVID on our nation is really bad right now. We've got a lot of people out there that are in a lot of pain, and I don't mind saying right now, Alliance could use your support right now. We've taken a big hit with this whole COVID situation, and my employees, they're worried about their jobs, and for good reason. Those of you that are out there in pain, if you can come help us out, we'd appreciate being able to serve you.
I can tell you this, that at least a couple of times a month, I'll get an email from somebody or a couple of people saying, remind me of the person who was on, the physical therapist who was on, because so often when you're here, Alan, you're giving people things they can do at no cost or almost no cost, like buying a tennis ball or using an old sock or something. So you're very quick to give back to people, so I think it's fair that you ask for it in return.
Thank you.
You can find Alan and his staff at Alliance Physical Therapy. They have locations truly all around the region, so the number you see doesn't appear to be a local number, but it is. The website there as well, so that you can find the location that is closest to you. Trust me, there will be one. They make it very easy. I'm going to go stretch some more.
There you go.